Dr. Crocker, welcome back to KLBJ. How are you, sir?
Good. How are you guys doing today?
Doing well, thank you. What would you like to say to the Austin public, first of all, regarding this swine flu?
Well, I think right now there's really more questions than there are answers. I think we really need to avoid any sort of panic. I mean, this is a concerning outbreak. But right now, the cases in the United States have really been relatively mild illness, certainly no worse than the regular flu. So we're not looking right now at an epidemic illness or pandemic illness that has an unusually high mortality rate, just that which would be expected with the regular flu. Now that's different than what the Mexico experience is, and I'm not sure that anybody knows why the strain in Mexico has resulted in so much more mortality, which is averaging, I think, about 4% there still.
Dr. Crocker, does it concern you that there's been reported case in Church Clemens, right outside of San Antonio, not far from Austin?
Well, I think, there are cases now reported from a number of places around the country as well as internationally. So that tells us a couple of things, I think. One, that this virus is unusually contagious. It's very easy to pass, so people need to take the same reasonable precautions they take anytime they're around somebody with the flu. Avoid people who are obviously ill. The space between people that's usually considered safe is 6 feet or so. And most importantly, the flu is spread very much by hand and to mouth contact. So when you're out in public places, make sure you wash your hands, don't touch your face, eyes, mouth, because that's a real important way that flu is spread, and that's something you can do to prevent the spread.
Dr. Pat Crocker is with us live on KLBJ. I understand you're having a meeting with health officials today. Is that right?
Well, there's 2 meetings. One is an informational and planning meeting at the Emergency Operations Center at CTEC, and another will be the emergency department managers and medical directors and infectious disease and pharmacy, et cetera, here at Dell Children's. And the purpose of the meeting is not that we're frightened about huge loss of life or anything like that. We want to be set up proactively so that when we do, if and when we start seeing cases in the Austin area, we'll have a smooth process to treat patients, to separate them from other patients as soon as we suspect or have a diagnosis of flu, and try and make things as smooth operationally as we can.
If someone thinks they have the flu right now, Dr. Crocker, what do you want them to do?
Well, right now, again, and I think this is real important, just because you think you have the flu or have a fever is not a reason to come to an emergency department. If you have a physician or a clinic that you go to, call them and follow their direction. Right now, this is not a severe illness in the United States. And no one knows why the course of the disease seems to be different here than in Mexico City. It could be a lot of reasons. It's probably a little bit soon to explain this difference based on what's called genetic drift in the virus itself that can result in more serious or less serious infections in different locales.
Well, this could change on a dime now, couldn't it?
It could change. Now, if you look at the 1918-1919 pandemic, what happened was that strain of flu actually got less virulent, causing less disease as time went on. It started off bad, and then it gradually mutated to something that was less severe. So you can't predict what's going to happen, and we're actually waiting for and hoping for some information from the CDC today or tomorrow more about the cases in Mexico City. Were they all very elderly? Were a disproportion of them elderly or under, 6 months of age? That might explain part of the difference. Mm-hmm. One other theory is that there may be some small amount of cross protection so that if a patient had an influenza shot this year or has had several over the past few years, maybe there's enough crossover that's mitigating the illness here a little bit. You'll still get sick, but maybe it won't be severe. But that's just a guess as to why our experience is so different than Mexico City's right now.
Is there anything else that you wish the federal authorities were doing in the United States that they're not doing so far?
No, I think the emergency response system nationally has sort of learned from prior mistakes, if you will. It sounds like things are being mobilized appropriately. Always we wish for more information all the time, and sometimes clinicians are a bit frustrated by delays in information sharing. But so far, I think the things that they have recommended are very reasonable.
We just quoted a member of Congress who wants the border with Mexico closed until this is resolved. What are your thoughts on that?
Well, containment of an outbreak of any highly contagious disease is extremely important. So there may be some utility to restricting travel at some point. Certainly people who are ill should not be getting on airplanes and traveling, because everyone on the airplane will then get exposed. I'm not really sure that it's time or effective to, limit border crossings at this point. But certainly travel to any area that has had significant number of cases in and out of those areas is going to spread the infection.
Dr. Crocker, thank you very much for taking some time. We know you're very busy. We appreciate the update. Ed, you have one other question?
I want to congratulate Dr. Crocker on being named to the Texas Medical Board by the governor.
Oh, thank you.
Congratulations on that.
Yeah, appreciate it.
Thanks so much, sir. We appreciate your time.
All right. Bye, guys.
Bye-bye.